We met 14-year-old Amos Tileba in Koboko. He contracted TB of the bones at the age of 3. His auntie, Naomi Tichiro, brought him to Koboko Health Center 4 as Amos' health deteriorated.
He was just feeling pain around the joints, actually the joints generally. Then mostly from the back here, which he cannot even bend.
Amos was living in Arua with his mother at the time. With his family bewildered about his condition, Amos' relief often came from painkillers.
Panadol, diclofenac, the mother was not serious. So when I brought him, I think the pain was now increasing.
Unknown to her, Amos had contracted TB of the bones. Dr. Martin Kasendwa, a medical officer at Maldmay Hospital in Kampala, is familiar with this common but not widely known disease.
It's a form of extrapulmonary TB, representing about 2% of all TB cases worldwide, and it can affect any bone in the body. However, the most affected bones are the weight-bearing bones in the body, that is the hip bone and the knee joint. It affects the spine. The most affected part of the spine is what we call the lumbar area and the lower thoracic area of the spine.
Symptoms of active TB include cough, fever, night sweats, and weight loss. However, they may be mild in some patients for months, leading in delay to seek medical care. Dr. Martin Kasendwa explains that all of us are at risk, but the most vulnerable groups are the very young, the elderly, and people living with HIV.
These are children below 5 years usually have immunosuppression because of their age group. They haven't yet developed the immunity to handle the disease. So what the national programs are doing, immunizing the children just after birth, so that they can develop immunity to tuberculosis. The very old as well are predisposed to getting TB, both TB of the lungs and extrapulmonary TB because of the age group, where the immune system usually gets weaker as we age. Conditions like diabetes, conditions like cancer, conditions like chemotherapy for cancer, and also chronic steroid treatment. All these conditions will make it easy for you to get the rare forms of TB, including TB of the bones.
Amos is now on medication, but his build is way smaller than those of his age. He also suffers from partial paralysis. His auntie blames the disease.
And also in class, if he sits from morning up to maybe 5 there, even walking becomes a problem.
As the disease progresses, spinal injury may occur, which may extend to the spinal cord, causing what we call paraplegia. Paraplegia means inability to walk because of damage to the spinal cord, inability to control urine and stool, and wasting away of the lower limbs.
Dr. Martin adds that if not well treated, TB of the bones could lead to deformities.
There's what we call a gibbous. A gibbous is a swelling on the back. Maybe in the Uganda they may say bango, with very severe muscle pain around the area where the swelling is. In some cases, they may develop what we call cold abscesses. An abscess is a swelling, what we call a jute, an accumulation of pus.
Dr. Martin says this is now a common occurrence due to delayed medication, but that drugs are available.
TB treatment is free of charge. We don't sell it, and because it is free of charge, no patient should refuse to go and access TB treatment.
But Amos caretakers are also concerned about the side effects that come with taking the drugs.
It's very weak. At times, the legs become paralyzed. At times, it feels dizzy.
Dr. Martin urged anyone on medication to continue despite the side effects.
Rifampicin will cause the urine to change color to orange. So when the patient sees this, it shouldn't worry them. It's coming from the drug itself. It's not something wrong. Something is going on with their kidneys.
He said abandoning the drug is the major cause of multiple drug-resistant TB, which takes longer to cure.
Usually treatment may extend for between 18 months to 24 months, depending on the response of the patient. So this is a lot of time in terms of time lost from the workplace, if this is a working person, time away from home,
Uganda subscribed to the Millennium Development Goal 6 target of halting and reversing the TB epidemic by 2015, which was met globally according to the World Health Organization. However, there is more effort required after Uganda missed the 85% target set by the World Health Organization. Walter Mwesigye, NTV Weekend Edition.